guys, it's Dr. Denney over at Four Paws at Fulshear Veterinary Clinic, and we're going to be talking about some frequently asked questions regarding cat anesthesia.
Dr. Denney, what kind of anesthesia is used for my cat?
So there's two different types of anesthesia that we use here at Four Paws at Fulshear. There is injectable anesthesia and then there's gas anesthesia. We most commonly use a combination of both. They get pre-medded with injectable sedation, and then once they have their breathing tube down, they're maintained on gas anesthesia.
What are common anesthetic procedures for cats?
So this is a great question. Dentals are going to be a good one, feline neuters, feline spays, growth removals, C-sections. If we are taking x-rays, if a cat's been hurt, like hit by a car, a broken leg, if we notice that there's a swollen toe and the cat's not bearing weight, looking for infections or fractures, so taking x-rays. Sometimes if kitty cats aren't being cooperative or they're getting stressed, then we might give them some sedation to go ahead and get our samples for testing, like drawing blood or doing treatments. So if we have a pet that's not quite sick enough to get hospitalized but sick enough to need treatments, then we may give some sedation to get those treatments done in hospital to make sure that it's not stressful for the cat. We do try to practice as fear-free medicine as possible.
Will my cat need an exam and lab work prior to anesthesia?
Yes, they will, 100%. So you do need to be a current client with Four Paws at Fulshear. You need a doctor-patient relationship prior to getting a treatment plan, to being set up for surgery. That is a requirement not only for Texas state law, that you must have a current doctor-patient relationship with whatever practice is taking your pet under surgery. But having an exam, make sure that I'm going to catch any possible health issues that your cat may have prior to anesthesia. That way we can tailor an anesthetic procedure that's just for them.
How do you ensure the safety of my cat under anesthesia?
So that's a great question. We actually do all the same monitoring that you get while you're under anesthesia in humans, we have here. So blood pressure, EKG, their oxygen levels with a pulse ox, CO2 levels in the blood. We like to measure or keep an eye on temperatures. We check jaw tone. We make sure that respiratory rate, heart rate is within the normal limits. So these are all trends that are closely monitored. We have a veterinary technician that their sole job while a pet is under anesthesia is monitoring that pet.
What pain medications will my cat receive before, during, and after the anesthetic procedure?
I think that's a really great question. I think cat pain control is something that's not dealt with because cats are so good at hiding their pain. So part of our pre-meds has something called ketamine in it, and ketamine does have pain blocking effects. Once they're in the preoperative with an IV catheter and they're already getting sleepy when we're about to place their breathing tube, they get an injection called Serenia, which is not only an anti-nausea but has some anti-inflammatory effects. If they're not having gastrointestinal symptoms, they will also get an injection of something called Onsior. That's an anti-inflammatory that lasts for 24 hours. Once we're closing, I do a lot of local blocks, which is kind of very similar to dental nerve blocks. So I'll do incisional blocks along incisions to ensure both the pain from the skin and the muscle layer is controlled. When they're in recovery and their temperature's above 99.5, then they'll get an injection of something called buprenorphine, either under the skin that'll last 24 hours or IV that'll last about 6 to 8, depending on which type of buprenorphine that you give. So pain control in cats is definitely very important.
How long does anesthesia last for a cat?
So it depends on the procedure. Neuters might take not as long. Spays are going to be a little more lengthy procedure, and it is an invasive full abdominal procedure. Dentals, it'll depend on the grade of the dental, how much dental work needs to get done. Are we extracting any teeth? Do we need to do any oral surgery? Are we having to do any bone grafts, antibiotic fillings, stuff like that? So it's very dependent on the procedure, but it is something you can ask prior to having your cat set up for anesthesia. Thanks guys so much. I hope this helped answer any questions you may have about cat anesthesia. Thank you.